Good afternoon. I'm Carmel Angelo, Mendocino County Chief Executive Officer, and this is our Friday afternoon media time with our health officer, Dr. Doohan. And this is the time that we try to give you the most current information and most complete information that we have regarding COVID-19. So at this point, I will turn it over to Dr. Doohan, and then I will do a very brief update regarding OptumServe and our testing a little later on. Dr. Doohan?
Hello, can you all hear me?
Yes.
Okay, hello Mendocino County. It's my honor to continue to serve you as your health officer as we go into May with this pandemic still here with us. So I want to share that there's been yet another rapidly evolving week in this pandemic, with the governor last Friday, when we last spoke, having just allowed the state of California to all enter stage 2 of the pandemic together. The governor, as well as around the country, we have defined this pandemic in 4 stages. The final stage, the 4th stage, is when we will have lifting of sheltering in place. And that is in the distant future. We don't know when that will occur, but it's not expected to be this summer. The first stage was when we were slowing the spread and flattening the curve, and we had some very limited opening of businesses in our communities. Now that we've been allowed to enter stage 2 together, as a state, there has been, I think, a lot of confusion across the state about what is allowed and what is not allowed in stage 2. So let me start by saying that the governor states what is allowed, and that in the counties, the health officer can always be more restrictive, but not less restrictive. So part of the rapidly evolving situation in the last week was that last Friday, the governor signals that certain areas of the business community would allow to be open. And then he added some more elements this week. So last Friday, I did a new sheltering in place order, as I had promised. I said that I would do a limited reopening by May 11th, and I actually did it by May 8th. And I did it in alignment with what the governor said could occur in early stage 2. This week, a couple of days ago, the governor allowed for some additional limited reopening. And so I've been working with county council all week to match the governor in what he said could be added to limited reopening. So please look for a new sheltering in place order, which I'm expecting to be releasing today at the end of the day, if not tomorrow, which is going to match the governor. For example, last week, the governor said that dog grooming was not allowed, and this week he did allow it. So you'll see dog grooming. Also, landscaping was added. So there's going to be some changes there coming out in the new sheltering in place order, matching up with the governor. And as always, we will put on our website the redlined version so you could see what was changed from the immediate last order and then the clean version. So those will be going up today. In addition, last week, we learned on Friday for the first time about a process which the governor calls attestation. This was new for us, and we learned about it as quickly as we could. Some counties rushed quickly to attestation on Monday and early this week. Other counties have not done their attestation yet. And in fact, other counties that are in our region are planning to do attestation knowing that it won't be approved because they don't meet the metrics. So there are counties that will not be approved in their attestation. And for us in Mendocino County, I want to be sure that the attestation that I submit, which will have my name on it, saying that we were ready for further stage 2 opening, will pass and we'll get an excellent rating, and that we will be in good standing with the state. So I am working diligently with a team, an excellent team that's been put together in our DOC and in our county executive team to help with the attestation process. We're actually very far along with it. We've completed it about 75% of the way. We're waiting for some additional information to come through, and we do plan to complete that attestation and file it with the state midweek next week, so that we can fully go into stage 2 by next Friday, which would be May 22nd. This is my hope and my plan and what I am committing to with my team. Regarding what that will look like when we go further into stage 2, because we've already done so much already to be right in line with the governor, and in fact, pushing into some of the gray areas and following the Bay Area when they've gone a little bit of ahead as well. There's not going to be a significant change next week overall, except it will have a significant impact in 2 areas. So the 2 areas that are left to reopen into the stage 2 later version 2.5, as we call it, sector, are retail to in-store shopping and restaurants to some limited in-restaurant dining. So these are 2 sectors that the governor said we could open up after attestation. These are the only 2 remaining that we need to open up. The others have been opened already as of Friday today. And so we will look forward to that. Currently, all retail is open to curbside pickup. That's what I did last Friday. So this will allow entering into the low risk businesses and shopping, and also the possibility, if restaurants are ready, to come in for some limited dine-in. Now, regarding the attestation process, it also includes it's not required, but a highly recommended COVID-19 containment plan. And I do intend to submit this with my attestation. And I think we are very strong in a multitude of these areas. One is testing, and we have some great news today to share about that. The other is case investigation and contact tracing. I also have some news to share about that we're very proud of. Also protecting the vulnerable, acute care surge, and community engagement. So in those areas, we will be also doing a containment plan, which, as I said, is not required, but is highly recommended, and we will be submitting that as well. Regarding the opening of the businesses, the governor did release a requirement that businesses that do open must have a 5-step process that they go through to indicate that they can safely reopen. And for that, for example, the first step is doing a risk assessment and a site-specific protection plan. The next step is training employees, and there's 5 steps in total. So I'm very pleased that the county, through our ad hoc Board of Supervisors Committee and West Company, have been working together to work with our business community to help them to do a safe reopening. And I was just in a meeting actually earlier today with the Board of Supervisors ad hoc for the business community and West Company about how we will put in place a self-certification process for businesses so they can self-certify that they've gone through these 5 steps outlined by the governor and indicate that they are safely reopening. And this self-certification will be done every 2 weeks by the businesses. And that is outlined in my sheltering in place order that I released last week. And that will remain in the sheltering in place order that comes out today and moving forward. So this extra week that I am giving the business community before I attest that we're ready to go into further stage 2 reopening is giving the businesses time to safely prepare, educate their staff, and reopen to the public in a way that doesn't endanger the business owners or the public. And so we're really grateful that we have that week to work with West Company and the Board of Supervisors to help our business community prepare. Regarding the number of cases that we've had in Mendocino County, we have, as many of you know, we've had 13 cases. And these cases, the first 5 were spread out over time, each of those isolated and their close contacts quarantined. They did very well. None of them needed hospitalization. Everything went very smoothly with those first 5. The next 7 represented an outbreak in Covelo that has been contained to all the evidence that we have at this time. That outbreak has been contained. And we're very grateful to the collaborative relationship with the Round Valley Tribal Leadership and the Round Valley Indian Health Center for the work that they have done to lead and how we've been able to support to contain that outbreak. We are continuing to do surveillance in Covelo, surveillance testing. We'll be going back up again Monday, and that's in cooperation with the the community there. And we're continuing to offer free and anonymous testing for those that might be concerned about their privacy if they test. For those that do anonymous testing, we're taking their phone number so that if there is a positive result, that we can follow up and inform the person. So that all of the surveillance testing that we've done, the county has done up in Covelo, has been negative to this point, except for one close contact that was early on. That was the initial, the seventh Covelo case was actually someone who lived in the household. And so that wasn't actually a surprise, because we know households tend to get a lot of spread within the same household. So anyhow, of the surveillance testing, other than that seventh case, which we actually expected was going to turn positive, there were no new cases from any of our surveillance. And that seventh I just mentioned was weeks ago. That's not news. That's old news, shall we say. The 13th case, which came out last week, this was a case of, again, a close household member of an early case that we had. And it was someone's been asymptomatic this whole time, never developed any symptoms, actually had a surveillance testing we did in the Ukiah Valley that identified this individual. They went back to, they had been in quarantine, now they're going to be in isolation because they're a case, but they've never been sick and haven't had contacts in the community. And so it doesn't represent to me a new case, but more a connection to an old case. So what I will say to you about the 13 cases that we've had is that all of them have been either one of two categories. Either they were exposed through travel outside the county, or they were the household members of a case. And therefore, despite all the surveillance we've done, we do not have any evidence of community spread at this time. We just have cases that picked up the virus outside our county, and then their close contacts. Every single case we've had has isolated their contacts of quarantine, and we've done case investigations and contact tracings for all of them. So we have done very, very well as a county. We have not had any uncontained outbreaks. There is another case that came up this week, and I want to take a moment to speak about that. That is a nurse at the Fort Bragg Hospital, the Adventist Hospital in Fort Bragg, that tested positive for COVID-19 outside of our county. They don't live in our county, they don't live in our state. And so this case wasn't tested positive here. So what I want to share is that when an individual tests positive in an outside county and an outside state, they are the responsibility of the health department of that state and that county. And in fact, I would not even have known about that case had it not been for Adventist Health sharing the information for, which we greatly appreciate. Adventist Health has been an excellent partner, and they've done a very good job, in my opinion, of contacting the people that were in contact with this individual who's no longer in our state. She's back, he or she is back home. And they've also put out the word that anybody who might have been a patient in the hospital during that time can contact the hospital for testing. So there's no evidence at this time that individual, that nurse, led to an outbreak, because none of the surveillance testing that's been done around this and none of the case investigation contact tracing that's been done in Fort Bragg has shown up any new cases. So again, there were some concern that I didn't report that nurse from Fort Bragg, but that's because it's not in our county and not in our state even. So regarding case investigation and contact tracing, we're really delighted to report that the California Department of Public Health, in partnership with the University of California, San Francisco, is doing training, 20-hour training for case investigation and contact tracing, which we are signed up for, and members of our county will be participating in. So we have a tremendous resource here in California with UCSF leading to train our own people in case investigation and contact tracing, which we're really grateful for. I'm also very grateful that our disaster health volunteers, which our partner NCO manages that volunteer resource, is providing us with volunteers for our case investigation and contact tracing, as well as our surveillance testing. And I'm very grateful to Dr. Jim Flaherty, who is volunteering at this time through the disaster health volunteers. And we're so grateful to him. He's been so generous with his time and such a committed partner for me as my deputy health officer and now as a volunteer. And we're going to be having some other esteemed colleagues coming forward through DHV to volunteer with us. And I'm very grateful to them. And we will announce them as they sign on and come onto our frontline workforce. You can be, as I said, I will be releasing a new sheltering in place order today and or tomorrow. We're working on it into the evening today. And one of the things you'll be seeing in this, that we are actually going ahead in our region to take the benefit of our low number of cases and how we've had no deaths, no hospitalizations, no uncontained outbreaks. So as a rural community that's done so well, we can go ahead in some areas. And what you're going to be seeing is a concept talking about households, household units joining together into stable groups of 12, so that you might have one stable household and another stable household that have been quarantining together, and that they can safely join together in a group of 12 in a family support unit. So for example, in our rural communities where we depend on each other so much, we might be able to have two families coming close together to carpool if their children are in childcare, or work together on the rural community to put up a fence. And in other words, when we have these bubbles, these household bubbles joining together of groups of 12 at maximum that are stable, that in that way we can have more social connections and we can help one another more closely as we come out of our periods of really being separated and quarantining. I know that there's going to be a lot of questions about these household support units, these household bubbles of 12, and we're just developing this today, actually, in the sheltering in place order. We've been working on it for some time. And so please know that communication remains an absolute priority, and that we will be sharing some detailed information about how to understand these household support units and bubbles more as we enter into next week. So thank you, and I would hand it over to Carmel Angelo to talk to us about the great news about OptumServe. Thank you very much.
Okay, well, thank you, Dr. Doohan. And yes, I would like to talk to you and to everyone regarding OptumServe. So some time ago, it seems like months, but it was only weeks ago, we were talking about how we move forward with testing. And then when Dr. Doohan knew that she would have to be moving forward with an attestation and the metrics that came from the state, it was clear that we needed to test over 100 people a day in order to make our metrics, in order to reopen businesses and reopen the county. So we began to speak with the state almost every day about how we can make those numbers, because we did not have the ability to analyze our specimens. So we had testing supplies. After some time, the state came through with testing supplies, basically specimen supplies. And we had our staff trained to actually go out, along with some volunteers, to actually go out and do the testing. And we were able to transport our specimens down to Sonoma County Lab. But what happened is all counties in the state have to make these metrics, including Sonoma County. So while Sonoma County has been a great partner for decades, they found themselves without the capability, or the capacity rather, to do their testing and our testing, basically analyzing our specimens. So we went to Senator McGuire, Assemblymember Wood. Obviously, Congressman Huffman has been there to assist us as well, and began to talk about what we can do. And we knew that the state had a contract with a company, OptumServe, to provide sites for testing, particularly for those areas within the state that did not have testing capability. And as we know, if you've been listening to Governor Newsom, who has been doing these noon press conferences every day, he began to talk about testing deserts. It became very clear Mendocino County had become a testing desert. And for those of you that have questioned our lack of a public health lab, we had a public health lab in this county. We did not have staff, as is very common that you don't have enough medical professionals or healthcare professionals in some areas, and we did not have lab staff. Public health labs that are accredited by the state require very specific certifications. So you need a certified lab and you need staff, including a lab director, that also has very specific credentials. There aren't that many professionals within the state that even have those credentials. So we found ourselves contracting with Sonoma County to bring staff up here for the lab. And even if we did have a public health lab today in Mendocino County, we would not have the capacity we need, which is approximately 135 tests or specimens a day. So as it turned out, after multiple calls and multiple meetings with Senator McGuire, Assemblymember Wood, we had reached a point where we really weren't certain that we were being heard by California Department of Public Health. So we did a call to action, and that call to action was asking the citizens in Mendocino County to help us, and help us by sending an email to the testing task force at the state. And we gave that email out, and we put out a plea that we're doing everything we can to try to reopen the county and keep this county safe and keep the people safe, but that we really needed some assistance, and could the people in this county please send an email to the testing task force at the state? And you did. And you did. And you are part of the solution. And we have a testing site now that we are working with the state on, and this will be OptumServe, which basically will be located in the fairgrounds, and we will have specific hours, and anyone in Mendocino County can go into the fairgrounds, register, and get a test. And then OptumServe takes those specimens, they send them out to a lab, and they get those results for us. And then, of course, public health is notified regarding any positive results. So what I'm saying is that thank you, Mendocino County, for your assistance. We now have our testing capability so that we can move forward with reopening the county. We will know what day we will be opening our OptumServe testing site, hopefully within the next few days. And my hope is that we will be able to open this site at our fairgrounds right here in Ukiah by the end of next week. So that's our good news, and we wanted to make sure that we shared that. For those of you that are wondering if you live out in remote areas in Mendocino County, if you have to travel to Ukiah to get a test, that answer is no. This testing with OptumServe will augment the testing capability that we have, and it will help us reach our metrics or our numbers that we need in order to reopen the county. Under Dr. Doohan's leadership, public health will still be doing surveillance testing in other areas of the county, and certainly if we have an outbreak, there will be outbreak testing as well. So this is the good news, some of the good news that we have to share today. And with that, I will turn it back over to Sarah Duquette, who is our person who does all of the great work for us with these media days on Friday. Thank you.
Hello, good afternoon. First up, we have Sarah from KZYX. You're live. Go forward with your questions.
Hi, thank you so much for giving this briefing. I have a question about the tests. I understand the state and the federal government will be paying for it, but I'm wondering what the cost will be to people who want to get tested. Will people in the community have to pay for a test?
Dr. Doohan, would you like me to answer that?
Yes, go ahead, please.
The goal of this testing is to attempt to test every Californian. So if you have insurance, then that is something that you must disclose. And if your insurance covers it, fine. But other than that, you will be able to walk in, and this testing is free.
And my next question is about translation and interpretation services. I understand that last year the county spent $27,000 so that members of the deaf and hearing impaired community could benefit from briefings. And I'm wondering if you could talk a little bit about contracts with other professional interpretation and translation services for other languages.
I'm trying to see who is the best person to answer that question.
Yeah.
Sarah?
This is Sarah Duquette. Well, we've been doing when we have the opportunity, we've tried to use the interpreters for the deaf, and what we've been utilizing over the past few weeks because of social distancing is closed captioning on all of our live feeds, so on Facebook and on YouTube. So you can choose the closed captioning. And we're also working to increase our Spanish communications as well.
Any other languages?
Not at this time.
That's all I've got for now. Thank you so much.
Facebook and on YouTube, so you can choose the closed captioning. And we're also working to increase our Spanish communications as well.
Any other languages?
Not at this time.
Hi, this is Mike Adair. Apparently, you unmuted me, but you're supposed to be talking to Adrian, I think. Hi, this is Mike Adair. Apparently, you unmuted me, but you're supposed to be talking to Adrian, I think.
Mike, can you hear me?
I can, yes.
Go forward with your questions. We had some technical difficulties.
Okay. All right. So my first question is, my questions are theatrical. Can you, and this is, I would assume, for Dr. Doohan, can you clarify the standards regarding children's theater? I am hearing stable groups of 12, no social distancing, no masks, but it is unclear because children's theater is a kind of a combination between theater and children's activities. So we're assuming no live audience and the show will be streamed. But what do the kids have to do when they are in a theater or on stage?
Well, thank you for that question. The children of our community are a top priority for me to get them to be able to play and get outside and have as much of a normal life as children can have in this really very difficult time. So what we're working on, one of the things that's going to be coming out today in the sheltering in place revisions is more language around children and what they are allowed to do. So we're allowing childcare, and childcare is for stable groups of 12, which is, I believe, what you're referring to. And in these stable groups of 12, the idea is that the same children would be in one childcare group for 4 weeks at a time. That's what stable means, and that will be in the sheltering in place order. So you can think of it like summer camp. I would have called it summer camp, but the governor has not allowed summer camp quite yet. So I think what we're going to be seeing in the coming weeks is that childcare will be called summer camp, or childcare / summer camp. But the idea is for either of these that you have one group of children, 12 of them maximum, that are in the same group for a month, for 4 weeks. And that group of children do not need to social distance, and they do not need to wear facial covering. And actually the group includes a teacher. So you might have 1 or 2 teachers and 10 children. It's a stable group of 12. So in terms of theater, yes, what you said I think would be right. If you had a summer camp or a childcare, let's call it childcare right now, and you included theater, then you would be able to film that group of kids and live stream that, and that performance could be shared in that way, but you wouldn't be able to have a gathering of an audience because the governor has banned gatherings, and that continues to be banned. Did I answer your question?
Yes, you did. Thank you. I've got two more questions. For regular theater shows with, older teenagers and adults who are over 60, if you're doing the show without a live audience, do you need to do masking, facial coverings, and will social distancing be required among that complement of performers?
So it would be to have social distancing and facial coverings to the extent possible, except if you're a part of a household support unit, what we're calling a family unit or a household unit. And the idea of this is that we certainly don't want people to come together for a live stream event and then spread COVID among them. So if you did come together for a live streaming event, which is allowed in my sheltering in place order, with up to 12 people, including the videographer, we would ask that you social distance, wearing facial coverings. And let's imagine that somebody in that group is singing, which is something I've been very concerned about because we've seen COVID spread very aggressively through singing. You would social distance to the extent that you would expect that you not to be able to spread COVID to the other person. So you would social distance to an even farther distance. So when we're talking normally 6 feet apart, that can be safe. But if you're singing, you would need to be either farther. And we don't know the distance needed for singing. There's been no studies that I've seen. So I would say the safest would be to sing at a greater distance than 6 feet, separated from other singers behind a plexiglass screen or something like that, so that the air droplets wouldn't spread to the other people.
Okay. One more question. Do you anticipate that social distancing restrictions for theatrical performances, even if streamed and with no live audiences, will be relaxed at some point? And if so, can you tell me when you think they might be relaxed? Are they going to be part of stage 4, phase 4, or phase 3? What do you think?
Well, the governor at this time has indicated that performances, gatherings, these types of things will be stage 4. And that's very hard, because that is not, anything that I'm seeing will not be even in the fall. I mean, I'm hopeful that perhaps we could see ourselves entering stage 3 at the end of the summer, but we'll have to see what happens when we start opening up in stage 3. And then stage 4 would be, I would expect, sometime after that. So I think it's very hard for all of us. But this limitation on performances, I think, is going to be with us for some time.
All right. Thank you so much.
You're welcome. You're welcome.
Hello, everyone. Can you hear me this time?
We sure can. You're up.
Great. Thank you, Sarah, for organizing this and handling all the technical aspects of it. And thank you, Dr. Doohan and CEO Angelo, for having this availability. If you don't mind, I'd like to ask a couple of sort of small questions about the OptumServe system. Where will those tests be happening? Roughly how many per day will be processed? And will people be able to do repeat tests?
So CEO Carmel, Angelo, if you're okay, I'll take these questions right now.
Please.
So there is a requirement for OptumServe, and we're so fortunate we're getting this resource. I mean, it's truly a celebration for our county that we got this resource. But we haven't seen the thing yet, what it looks like. It's been described. It's been described by some of our neighboring counties that received the OptumServe resource, like Humboldt and Sonoma. But it requires a brick and mortar facility. It is a resource that allows us to collect the samples and then have them shipped off to Quest Laboratories, which, as far as I know, is in San Juan Capistrano, Southern California. So it is going to be located in our most recent discussions, and Carmel Angelo can speak to this, I believe in our fairgrounds. because that has the room to be able to drive in. It has brick and mortar facilities. So I would like Carmel to follow up on that in a moment. But it absolutely will be used to retest people because, for example, let's look at our frontline healthcare workers. We would like them to be tested with some periodicity, like let's say once a month, because we want to be sure that we continue to do surveillance for those people that are on the front lines that have the higher risk of COVID-19, or even our grocery store clerks, or our people that work in skilled nursing facilities, even our people that are in the disaster service workers, people that are going out and doing our surveillance testing themselves. So there are groups of people that are the highest risks, but we also want to be sure that people, general community members, can be tested. And it wouldn't do any good to retest every week probably, because it takes time for a person to turn positive. So I wouldn't expect that type of frequency of testing, but something like once a month could be for those people who have more exposure. And it's very important to point out that our clinics, our great clinic partners, will still be doing testing as they already have been, because if somebody's sick, they should call ahead to their clinic, or if they're sicker, they would call ahead to the emergency department, and they would still be able to be tested in the hospital or clinics through the normal routes that we've already had in place for testing. So it's not going to do all the testing for Mendocino County, but it will help us to do, our goal is 135 tests a day times 7. So, we want to do 1.5 tests per 1,000 people, and we have 90,000 people, and we want to ramp it up eventually to 2 tests a day per 1,000 people.
Okay. And those are going to be the nasopharyngeal test?
Yes, it's a nasopharyngeal swab, and it's done by a nurse or healthcare worker who actually does apply the swab deep into the person's nose, because that's the most sensitive type of testing, versus the Verily resource, which some counties have gotten. And with that Verily resource, it's a self swab. So the person puts the swab into their nose themselves. And we know that that's not as sensitive because it's hard to get the swab deep enough safely into the nose to get that deep sample that is the best type of sample to get for COVID testing at this time.
So I'm just trying to wrap my head around the nature of this testing. This testing, it seems like it's going to be contributing to surveillance testing, and that it's going to be going to frontline workers, grocery store clerks, that kind of thing. But people will also be able to drive up, and there will be some 10s to maybe 100 tests available there for the sort of on a first come, first serve basis.
Well, it's actually one of the great things about this resource is there's an ability to make appointments. Then those can be made online. I believe there's also a phone number. So we haven't gotten the resource yet, and I'm sure when we get it, we'll learn more about all of the different details. But definitely, there's a way to make appointments, and that includes online. And the reason why we wouldn't want to test sick people to the extent that they can go through their clinic or hospital is that's the best place for people to be evaluated. But it is a resource where it should be fairly straightforward for people to make that appointment, know that it's their time to drive through. And then the resource keeps track of who was tested. And then the samples are shipped out of town to Quest for the processing at the lab at Quest.
Dr. Doohan, let me just jump in on a couple points here. Everything you said is accurate. We will be I believe we will be at Carl Purdy Hall at the fairgrounds. And we have done an assessment of how many healthcare workers, as Dr. Doohan had said, and skilled nursing facility workers, first responders. The testing will be by appointment. However, there will be opportunity for walk-ins, and the testing is for everyone, as Dr. Doohan said. So we believe that we will have a system set up where we have specific hours initially in the morning that will be for our first responders and our essential workers, and then the rest of the day will be for members of the general public. So as Dr. Doohan said, the OptumServe testing is for everyone, and it augments what we're already doing, but there will be an opportunity for walk-ins, though appointments are really favored on this. And again, it'll be at Carl Purdy Hall, and I'm hoping by the end of next week to have this set up.
Oh, that's fantastic. Real quick, one for Dr. Doohan. Could you address the rate of false negative in these tests? I've seen some recent information come out about where they seem to be narrowing down a better range of the false negative percentage.
Yeah, so that's referring to sensitivity, generally, the sensitivity of a test. And with the PCR tests, the molecular tests or the diagnostic tests, these are these swab tests. It depends on the machine being used. So it depends on what lab the tests are processed in. So you've probably been hearing about this in relationship to the Abbott ID Now, which is a rapid PCR test that gives a result back, I think it's within an hour, or it might be 2 hours. But that test is less sensitive. And so it depends actually on the machine. I think with the Abbott machine, I've seen a 30% false negative rate with that one. But let's say 20 to 30%. And then, the Ukiah Hospital has a BD, B like boy, D like dog, BD machine, which has higher sensitivity. And this is why when we talk about the Abbott machine not being ideal for people who are without symptoms, it's because of that false negative rate. And it's just sort of the complexity of testing. No testing is perfect, but we would prefer the Abbott machine to be used for people who are having symptoms and are more likely to have a positive result. When you do the PCR testing, you can trust the positive. We say, the positive tests are true positives. The negatives might be false negatives. So if you have a negative test and you suspect the person really might have COVID, you want to retest them with a higher sensitivity test. That's actually what happened in Covelo. The individual that I brought up that was tested positive in surveillance, our 7th Covelo case, this individual had tested negative initially because they were asymptomatic. And were tested on the Abbott machine, and we retested them and they came up positive, but we already knew about them, so it wasn't a surprise. We were intentionally retesting this person, knowing that their initial test needed to be repeated.
I wanted to ask you for my third question. You've described some of the things that are opening up. I want to give you an opportunity, if you'd like, to list the things that are still closed, because it seems like we're at a stage where it might make sense to list closures rather than openings. You know what I mean?
Yeah, so I'm not looking at that list, so I'm going to speak it to you from memory, but for another week, our retail is only open to curbside pickup, not in-store shopping. But my expectation and plan and commitment is to open all of our retail to in-store shopping in a week. Our restaurants are open for takeout, but not dine-in. And so I expect at the same time with the retail in a week on the 22nd, the restaurants will open up for in-restaurant dining. That's going to be limited though. And those limitations are from the governor. The other areas that the governor has not allowed to open up at this time is school for normal type school operations. Schools are have to have modified schooling with distance learning. As well, the governor is not allowing gatherings of any size and not allowing, so therefore we don't have theaters and we don't have sports events, and we don't, with a heavy heart, we all talk about we don't have religious services. We don't have, let's see, festivals, ceremonies. Trying to think of what else I might be missing here. But the other thing we don't have at this time in stage 2 is bars, wineries, and that's from the governor, and like dance nightclubs. The other thing we don't have is personal services like, and this is from the governor, haircuts, nail salons, massage studios, these types of activities where you come quite gymnasiums, and this is all from the governor. These are called higher risk activities, those are for stage 3 and 4.
And tourist lodging.
Thank you. Lodging for tourism and leisure is closed until stage 3 per the governor.
Thank you very much, Dr. Doohan, CEO Angelo, Sarah.
Thank you, Adrian. Next up, we have Matt with KMUD.
Hey, folks. Thank you, Dr. Doohan, CEO Angelo, Sarah, for hosting this press conference today. My first question just has to do with language. Last week, it was announced that Round Valley's outbreak could have, or is characterized as going underground. That word, I think, by some has connotation of, secrets being kept or information not being transparent to the public. I was just wondering if there's like an epidemiological context for that phrase, or if you could kind of explain what led you to make that determination, Dr. Doohan.
Yeah, and I want to thank you, Matt, for giving me the opportunity to speak to that. I have made a commitment to Round Valley that in the future, when talking about the outbreak, to have them, and I would really love to have the opportunity to have Round Valley Indian Reservation, to have tribal leader President Russ and the clinic leadership to be on an interview with me. And I want to apologize because I think using that word, it wasn't an interview and it was a word that I came out of my mouth. I actually regret it at this point because I think it has a connotation that wasn't appropriate. So what I meant to say is that through our case investigation and contact tracing, like any case investigation and contact tracing, especially one where a number of the cases were asymptomatic, so they didn't even know they had the disease, that we can learn about individuals that we might think might have gotten sick, but we're not sure about it. We don't have the information yet. And as we're trying to contact those individuals, we haven't been able to contact them. So it's that the meaning for underground is that we weren't able to contact all of the individuals that we had hoped to contact. And we were reaching out, public health was reaching out in the general community of Covelo, not on the reservation lands, but off the reservation lands in the town. And I understand there's a lot of blurry lines between where does one thing end and when does another thing start. But we were working in the community, like, for example, with local businesses, setting up our public health, surveillance teams where we're offering testing. And what I came to believe was that our presence in the town was perhaps making some of the townspeople feel that their privacy was being invaded and they were not feeling comfortable coming forward to us because maybe they didn't know our intentions. So what we've been trying to do now with our surveillance teams going up there to do testing is to really message that we're here for the public's health, that we want to protect privacy, that we are offering anonymous and free testing, and that if an individual wants to be tested and not give us their name, we just ask that they give us their phone number so that if there's a positive result, we can call them. And the reason why I thought I used this word underground, which I now regret, is that when we went back up for testing last week, very few people showed up. So we were there and we were ready to do testing, and we had done over 100 tests in the prior times we've gone, but these other times we had very few people coming forward. So I was concerned that we were scaring people away, we weren't giving the right message, and that we were actually causing fear in the community or stigma. Stigma can happen when people feel that if they test positive, they've done something wrong or they're going to be shamed or harmed. And COVID, because people don't even know they have it, there's an asymptomatic period. There's no shame, no harm. In fact, we're just trying to help to reach out to let people know that we want to offer free and anonymous testing. So that was the purpose of that comment.
Thank you for providing clarity on that.
You're welcome.
The second question, and I please correct me if KMUD's understanding is wrong here, but essentially what we're seeing is Mendocino County is updating COVID numbers 3 times a week. I was looking at the Facebook public health page, and the cover art graphic, the infographic that demonstrates it, is updated 3 times per week. Opposed to Humboldt County, other nearby counties that are updating every day. And we're curious as to why aren't we updating every day like other counties nearby?
Yeah, well, I would actually ask Sarah to make a comment on that because she's our PIO, but I will also tell you that because we've had less cases, we've only had 13. There was a rhythm to the posting that it just was helpful to us for how we operate to not set the expectation for the public that every day we would be posting. So I don't know, Sarah, would you like to respond to that question?
Sure. So what we've been doing is we haven't really seen a huge change in case numbers day to day or even week to week. And so we set a schedule and we post every Monday, Wednesday, Friday, and you'll see in the infograph that the main areas that typically change are the number of pending tests and at what lab they may be. So maybe it's at a public health lab, maybe it's at UCSF or a commercial. So it's really our total testing numbers, and if they're pending or not, that is the information that changes frequently. And I also like to add that we do also post outside of that schedule for significant changes. We do our best to notify the public as soon as possible when we do have a new case. So you'll be seeing our infographic, like I said, every Monday, Wednesday, Friday on our website and all of our social media platforms. And we also will do additional postings if anything significant happens.
Thank you for that. For my last question, this has to do with law enforcement, firefighter, other first responders, and how the social distancing and facial covering guidelines are applied to those sectors, and how they're adapted to their work realities of having to be in close quarters, navigate close interactions with the public. Probably Dr. Doohan could speak to that most specifically.
Yeah, well, that's a great question. And there are 2 orders that are up online that are related to masking and facial covering. One is the facial covering for public order, and the other is the masking for congregate setting, medical settings. So there's one masking order and one facial covering order. So in the masking order, you'll find the language regarding public safety and first responders and the guidelines for them to wear medical grade masks. Whereas the public facial coverings, those are homemade masks or cloth masks. So there's quite a lot of detail in that order for the medical masking. And it doesn't only include first responders, public safety, it also includes skilled nursing facilities, hospitals, clinics, and medical environments. But it's true that for, let's just take firefighters, it is concerning because of the nature of how we house our firefighters, that they can be in close proximity, and they might not be able to have social distancing, which is one of the reasons why in those guidelines about masking, it says that these workers should be symptom checking before they come to work, and they shouldn't come to work if they're sick or if they have elevated temperatures. This is one of our very, very important protections against COVID, is making sure that people who are sick stay home. And even if they might be having the early symptoms of COVID, like, just a little sore throat and a slightly elevated temperature, that we're keeping track of that and making sure that those people are able to stay home and not come to work. Did I answer your question?
Absolutely, Dr. Doohan.
Okay, thank you.
I want to thank everyone for once again hosting this press conference.
Yeah, very important. Thank you.
Thank you. Next up, we have El Punto.
Thank you, Sarah. Thank you for having Periódico El Punto provide information for the Spanish community. This question may have been previously answered in English, but we need this information in Spanish. My first question is, ahora que el condado tendrá más capacidad para hacer los tests a más personas y poco a poco se están abriendo los negocios, ¿Se van a hacer pruebas a los trabajadores antes de que los negocios abran nuevamente?
Bueno, en realidad, las pruebas de laboratorio que estamos haciendo están siendo por grupo de riesgo. Aún no tenemos un sistema establecido para que todos los negocios que se vayan a abrir vayan a hacer a los trabajadores se les vaya a hacer el despistaje si es que tienen o no tienen el COVID. Nosotros vamos a implementar un sistema en el cual cualquiera puede hacer una visita vía online o incluso ir a hacerse la prueba, pero va a ser por demanda, no va a ser que nosotros vamos a ir a desplazarnos al negocio determinado y vamos a hacer la prueba a todos los trabajadores de allí. Eso no está diseñado de esa manera, digamos.
Okay. Mi segunda pregunta es, ¿cuándo se va a comenzar a hacer las pruebas para el COVID-19 y quiénes podrán pedirlas? ¿Tienen ya un lugar específico en donde se van a hacer estas pruebas?
Bueno, la prueba para el COVID-19 la estamos haciendo ya de hace un buen tiempo, pero de repente la pregunta sería que no las hemos hecho en la capacidad o la cantidad adecuada de acuerdo a la población que tenemos. Pero ya se va a firmar, bueno, se ha firmado un contrato con una compañía que ellos van a estar localizados en la feria que está al norte de la ciudad. Ahí ellos van a estar instalados. Esta compañía va a permitir aumentar la capacidad de hacer el número de pruebas acá en Ukiah. Sin embargo, por ejemplo, acá en Ukiah, hasta que abra esta compañía en la feria, nosotros pensamos que de repente puede ser para el fin de semana o para inicio de la próxima semana, pero mientras tanto, por ejemplo, ya está diseñado para la próxima semana en Ukiah, entre el día miércoles y jueves, se van a estar realizando pruebas en el Mendocino College. Estas van a ser por demanda, va a haber una cantidad determinada, no va a haber muchas, pero va a haber una cantidad determinada que las personas van a poder aprovechar de esta oportunidad. Igualmente, en Fort Bragg, también, un día va a ser el miércoles, otro va a ser el jueves, para cada día. Lo que no sé exactamente es qué día va a ser el jueves en Ukiah y qué día va a ser en Fort Bragg. Igual, también va a haber una cantidad de pruebas determinadas. En Fort Bragg va a ser en Mendocino Coast Clinic, en la clínica de la costa de Mendocino. Y en ambos lugares va a ser entre 9 de la mañana y 1 de la tarde. Y ya una vez que ya tengamos la nueva compañía funcionando en la feria, yo estimo que ya vamos a poder fácilmente, porque ahora estamos haciendo 100, fácilmente vamos a poder llegar a la meta que es 135 por día, y allí van a poder ir todas las personas que consideran tomarse la prueba. Por ejemplo, si alguien tiene aseguranza, simplemente presenta su carnet de su seguro de salud, pero si no tiene y no tiene recursos, va a ser completamente gratis. Ya, yo creo que básicamente es
George, las pruebas estas pruebas que se van a hacer son como pruebas como para monitorear, ¿verdad? Y para la gente que no tenga síntomas de COVID-19.
Claro, bueno, cuando nosotros simplemente, en esta estrategia hay dos formas de poder abordar el problema. Uno es que nosotros hacemos de manera aleatoria, o sea, es decir, de manera, o sea, sin saber exactamente quién es, alguien viene, le hacemos la prueba y después viene otro, le hacemos la prueba, o vamos por la calle, nos sentamos en un lugar y ahí hacemos la prueba. Esa es de manera así aleatoria, al azar, para de acuerdo a eso, tomamos muestras de diferentes lugares y podemos nosotros tener una idea de cómo es que estamos nosotros yendo, porque pueden haber asintomáticos caminando por la calle y podemos nosotros captar un porcentaje de ellos. Y lo otro, esa es la primera modalidad, que es el de, son pruebas de vigilancia, digamos, vigilancia epidemiológica le llaman. Y la otra modalidad es para aquellas personas que tienen síntomas relacionados al COVID. Recordemos que los síntomas relacionados al COVID son síntomas muy parecidos a cualquier gripa. O sea, alguien, por ejemplo, estima que tiene tos, que puede tener un poco de fiebre. Nosotros no vamos a saber si es COVID o no, porque puede ser un resfriado común, puede ser cualquier otra familia de estos coronavirus que dan síntomas muy parecidos hasta que no hagamos la prueba. Entonces, esas personas pueden ir y hacerse la prueba para saber si es que tienen el COVID o no.
Okay. Muy bien. Y mi tercera pregunta es, como bien sabemos, hay una comunidad de trabajadores agrícolas y de reforestación que vienen de países donde se habla español con su visa H2A a trabajar todos los años a esta área y viven en un hotel al norte de la ciudad. ¿Se ha contactado o dado información a estos trabajadores de la Orden de Salud Pública? A esto me refiero como el uso obligatorio del protector facial o de mantener la distancia social o física.
A ver, cuando nosotros damos una ordenanza de salud, esta ordenanza de salud tiene que ser implementada por las personas, tiene que ser implementada por los negocios, cualquier variedad que sea el negocio En este caso, por ejemplo, estos trabajadores vienen por una compañía y la compañía tiene que adherirse a lo establecido en la ordenanza. La ordenanza, ellos están en la obligación de proveer toda la seguridad necesaria a sus trabajadores. Lo que hace el condado simplemente es supervisar para ver si es que esta compañía que tiene a estos trabajadores está cumpliendo o no está cumpliendo con la ordenanza. Asimismo, estos trabajadores por la compañía que vienen, ellos deben tener como parte del paquete de beneficios un tipo de seguro de salud. Entonces, igualmente, si hay alguno que se ha identificado, ellos ya tienen contrato con alguna clínica local determinada para que llevar a las personas enfermas para que le hagan el screening e identificar cuál es el problema con estas personas. O sea, cuando nosotros hacemos estas actividades de salud pública, por ejemplo, la que vamos a hacer en Mendocino College o la que vamos a hacer en Fort Bragg, nosotros la hacemos al público en general. Porque nosotros como salud pública estamos encargados de la salud pública en general, de todos en general. Pero ya por ciertas particularidades, por los tipos de negocios, son las empresas que tienen la responsabilidad de hacer cumplir la ordenanza y proteger a sus trabajadores.
¿Y hay alguna manera que el condado pueda cerciorarse o verificar que sí se esté dando la información a los empleados?
Bueno, en este caso lo que se podría hacer es que si alguien teme de que allí de repente no están siendo tratados adecuadamente estos trabajadores, podrían llamar a la central telefónica y ellos tomarán nota y lo pueden derivar al Departamento de Agricultura para que el Departamento de Agricultura con alguien de salud pública lo visite y verificar en qué condiciones ellos están trabajando, si se están respetando las condiciones de salubridad y seguridad y de protección fundamentalmente para el COVID-19.
Ok, muchas gracias.
Thank you, Jackie. And now we'll go over to Carmel Angelo for some final comments before we go.
Thank you. Thank you, everyone, for being with us today. And again, we continue to progress. I think things are improving as far as how we are adjusting these days. And I would like to thank Dr. Doohan for her efforts and for being with us today. One point of interest, if you go on the county website or you go on the county Facebook page, you will get the latest information and you will see that our parks are open for hiking and walking. There is no overnight camping at this point in time, but the parks are open. If you are going to hike through our parks, please remember social distancing and wearing your facial coverings. So with that, thank you, everyone. Have a nice afternoon.